How do geographic barriers impact health equity? Imagine trying to get to a doctor when the nearest clinic is 50 miles away. That's what many people face in rural or remote areas. Geographic barriers are physical obstacles that make accessing healthcare difficult. These barriers are especially common in rural communities where hospitals and clinics are few and far between. When healthcare facilities are far away, people often skip or delay seeking care, which can lead to worse health outcomes. Long distances to healthcare centers are a major issue. If it takes hours to reach a doctor, many might not go at all. Poor transportation infrastructure makes it even harder. Without reliable roads or public transit, traveling becomes a real challenge. This problem hits low-income families hardest because they may not afford private transportation or have the means to travel long distances regularly. In rural areas, there are usually fewer doctors and specialists available. This means people might have to travel to urban centers for specialized care. The shortage of healthcare providers in these areas creates disparities in who gets timely treatment. These geographic issues often lead to higher rates of preventable diseases and complications in isolated populations. From an ethical point of view, these barriers challenge the principle of justice. Justice calls for fairness in healthcare access. When some communities cannot reach care easily, it creates unfair differences in health. It also affects beneficence, which is about doing good for patients. If people cannot get the care they need because of where they live, their health suffers. To fix these issues, many health systems are turning to telehealth. This uses internet and video calls to connect patients with healthcare providers remotely. Improving internet access in rural areas makes telehealth more effective. Mobile clinics and community health workers are other ways to bring care directly to people who cannot travel easily. Policies are also needed to address these disparities. Investing in transportation options, building more clinics in underserved areas, and training local healthcare workers are all steps that help. These actions make healthcare more accessible, no matter where someone lives. In the end, geographic barriers create real challenges for health equity. They limit access based on location, which can lead to poorer health for some populations. Addressing these barriers is essential to ensure everyone has a fair chance at good health. It aligns with the core medical ethics principles of justice, beneficence, and non-maleficence, helping create a fairer healthcare system for all.